Welcome to the Beverly Hills Plastic Surgery Podcast. I am Dr. J. Calvert, and I am here today with the famous and bountiful Dr. Millicent Ravello. How are you, Dr. Ravello?
I'm feeling very bountiful.
I know you are.
I'm not sure how one feels bountiful, actually. I have this image of like a cornucopia. But I guess today I am bountiful.
I think I was referring to the fact that you've just been producing so much in terms of work and video and television and
a whole bounty, if you will.
You're bountiful. I mean, I can't get over how much you're doing.
Yeah, I got a lot on my plate right now. A lot of spinning plates, actually.
That's right.
One or two might crash. Sorry.
Hang on a second. I gotta get this one. But you're doing it with like style and grace.
Well, thank you. Thank you very much.
It's a lot.
It is. But you know what? I love it. Everything is good. It's all good.
Can't beat it.
And how about you, Mr. Blue Scrubs? You look very comfy today.
There are two sizes of scrubs back there today for some reason. Extra large and extra small. I had to pick one or the other, and I chose extra large because I thought extra small could be a problem.
And we here in the office are very glad that you did not choose the extra small.
No, but I did have a colleague in the past, and those who are listening who know my colleague will know who it is, who would choose the extra smalls. And he was my size.
Oh.
I don't know why. I don't know what that was about. Just no.
Talk about bountiful.
And not in a good way. But what we're here to talk about today is the facelift after age 40.
The 40s facelift.
It's the time.
It is. It is absolutely the time. By the way, I am turning 40 this year. Just putting that out there.
I'll prepare the OR. I know it's coming.
Perla,
get Perla back here. Well, we're going to do a preemptive facelift, which I've talked about, by the way.
Yes, and the 40s facelift is definitely a thing. It might be a regional thing. I think it's a bit of a harder sell elsewhere in the country, but it shouldn't be. I think that the 40s is really when you definitely start to notice the signs of aging in your face. In your 30s, they are camouflaged with the Botox that you do and some fillers. But when you start getting into your early mid-40s, you may start to be hitting a wall with the fillers and the Botox. Or they're just not doing what you want them to do. And I know when someone is ready for a facelift, when they come into the office and they do this move. They look at me and they turn to the side or they push the skin of their jawline, their neck up, and they're like, I just want it to look like this. So is that going to be like cheek filler or is that Botox or like, how do I do this?
So for those of you listening at home, what Dr. Ravello is doing is taking a 3 to 4 finger hand and pushing on the side of the cheek and tensioning the skin over the mandible, over the jawline.
Up to the ear,
elevating the neck.
And like getting a better jawline and smoothing out the skin of the neck. I just want this, they say, as they push and lift the skin of their face up.
Like, yeah, that's a facelift. That's what that is.
That's a facelift.
A facelift is kind of a misnomer, and we should start with some definitions. Yeah. And by the way, I had a friend who used to come in and do that same move and be like, I just really want to get my eyes done this year. And I'd be like, those aren't your eyes. And he literally would be like standing in front of the mirror in the hallway going like, if I just get my eyes done. I'm like, that's a facelift,
you're not
dude.
Touching your eyeballs.
That's not your eyeballs. Nope. You don't need your eyes done. That is a face and neck lift.
But let's talk about the difference between a neck and a facelift because that comes up a lot. And I usually find it more in men. Men come in asking for a neck lift.
Yes. Well, they do not want to use the term facelift. So they want a neck lift.
I want my neck done. And to be fair, women come in too saying, I just want my neck to look better.
Right.
In their 40s, that's usually what they say. It's their neck that's bothering them. But what they really mean and what they're really pointing to is, yes, the extra skin, the hangy down skin of the neck, but it's also the jawline that maybe they don't know is what's bothering them, but it's what's bothering them.
For sure. And so